Children's Mercy confirms they've treated 2 kids with a mysterious inflammatory illness we've seen spreading across the county and the country. One is still in the hospital. KMBC9's Matt Evans live this morning. And Matt, doctors gave us a little more insight into what's happening.
Well, Rob, this is a very concerning development in the fight against the coronavirus because children at first were considered extremely low risk to develop any kind of serious complications from COVID-19. But there are now cases across the country and here in Kansas City of children developing very serious symptoms from a very rare syndrome. It's called pediatric multisystem inflammatory syndrome, and Children's Mercy Hospital has seen 2 patients with it. One of those patients has been released. The other remains in the hospital this morning. Those symptoms are similar to the inflammatory Kawasaki disease, but more dangerous, with some children going into cardiac arrest or having multiple organ failure. Symptoms to watch out for include a prolonged fever, several days over 101 degrees, a rash, red eyes or lips, swollen hands or feet, and difficulty breathing. Doctors at Children's Mercy, they say it's crucially important to track these cases to get a better understanding of how this is affecting kids.
There's a national registry that we are submitting de-identified data to, as are all the children's hospitals across the country, to really get a better understanding of that. Recognizing that although this is a serious condition, for the most part, children recover well and are able to go home afterwards.
A very serious development because there are now 3 deaths of children in New York State that have been linked to this type of syndrome. Although it is serious, doctors again want to emphasize it is rare, but they do say that this underlines the importance of keeping very close tabs on our children's health, especially in the midst of this pandemic. Live in Overland Park this morning, Matt Evans, KMBC9 News.
All right, Matt, thanks so much. Well, the state of Missouri, meanwhile, has a new plan to prevent coronavirus outbreaks at long-term living facilities. From now on, if a single resident or staffer tests positive, the facility is expected to go through comprehensive testing.
To go in and check everybody, a capability we didn't have a month ago. But as the governor said, there are 50 facilities right now that meet that definition as of today. So we worked all weekend, we're working today to go in and test everybody. And so that's our boxed-in strategy, which we think will serve us well.
Well, there are 4 coronavirus outbreaks at Jackson County long-term living facilities. Platte County is reporting 2. Cass and Clay County are each reporting 1 similar outbreak. And we are tracking new COVID-19 cases in Kansas. Kansas is now reporting 454 new cases. We'll now take a look at the average percentage of positive tests over the last 2 weeks. It has dropped from 17% to 10.6%. The World Health Organization says anything under 10 is encouraging. If a high percentage of tests come back positive, the WHO says it shows not enough testing is being done to accurately reflect how many people have gotten the virus. In Missouri, which reports new numbers every day, recorded 156 new cases of coronavirus Monday. The percentage of positive cases in Missouri is now at 3.4, down from 8% just 2 weeks ago. And we now know that wearing a mask in Prairie Village will not be required. Council members in a 7-5 vote rejected an ordinance making the coverings mandatory, but leaders strongly encourage people to wear a face covering in public. Well, it's 8:05 and Kansas City, Missouri's top doctor also says people should be wearing masks. Health Director Dr. Rex Archer updated District 5 council members last night on what the virus is looking like in Kansas City. He says he expects things to get worse as we reopen. He also stressed that one of the best things we can do to stop the spread of the virus is wear a mask.
A lot of the people that have this disease now don't have symptoms. They can spread it to a loved one, family member, a coworker. So we both need to be wearing masks when we're around other folks to stop the spread. And that will help a whole lot. And then we can open up more effectively and be safe.
Earlier in the day, Dr. Archer joined Mayor Quinton Lucas to testify before Jackson County lawmakers asking for funding. The county received all of the local federal money to fight the coronavirus, nearly $123 million. Mayor Lucas wants $54.5 million for KC. He maintains that's the city's share based on the percentage of the county's population. County leaders are worried, though, that if there is any misspending, well, they, not the city, would be on the hook for the feds. Well, Mayor Lucas promised a deal to take them off of that hook.
To sign an MOU today that says we have double indemnification. We will make sure that you are held so harmless that even if the state goes bankrupt, the city's going to stand in the shoes and pay you off.
Jackson County Executive Frank White says it is up to the legislature to decide what to do. Well, as more parents, meanwhile, are heading back to work, more children are going back to daycare. At least parents are trying to bring them. We're hearing that many families, though, are being turned away. In Clay County, places like Quality Care Learning Center are limited to 10 children per room for social distancing. Well, that means the owner, Darla Brown, is turning away 23 of her families who need their child care back.
They're frustrated too. They understand, and we all do, the importance, and we're doing all the procedures that the health department has asked us to do. But they're at a point where they have to go back to work, and now they're paying for childcare that they can't get, and they're not sure what they're supposed to do either.
Darla has been in contact with the county. She's asking for special consideration for daycares. Darla is also suggesting ways to safely allow more children to come back. So far, she says nothing has changed.